share with you important facts on toxic molds and their mycotoxins. In telling you a little bit about myself, I'm a fellow, first of all, that this lecture is evidence-based. And what does that mean? It's based on medicine, the best medical and scientific evidence from published studies combined with the doctor's clinical expertise, which is in my case, over 30 years. So I've published over 100 studies. I have lectured at medical schools in England, United States, Canada, and Mexico. So I have the credentials. I'm also besides being a fellow of the Royal College of Medicine in London, I'm also the editor-in-chief of various medical journals. I'm the co-editor of a medical journal and a reviewer on the editorial board of several others. I want to share these two things with you. On the internet, there's a lot of misinformation. Wrong does not cease to be wrong because the majority believe in it. Dr. Facebook and Dr. Google are not the ultimate authority. And second, if you have knowledge, let others light their candles with it. So this is an AI, artificial intelligence, Google. You can see that the urine test measures levels of mold metabolites. It doesn't measure mycotoxins. It's important to note that the CDC and FDA do not endorse these tests for clinical diagnosis. You should not use them for any kind of diagnostic purposes. Blood serum antibody testing is considered more accurate for detecting mycotoxin exposure, as published studies have shown urine testing to be invalid. Here's what the CDC shows you: use of invalidated urine mycotoxin tests. So here's another study that was just published in April of this year, 2025. This study highlighted the challenges involved in the modeling relationship between urine excretion of T2 toxin over time. The findings indicate that approximately 20% of the external exposure could be traced back to the urine within 24 hours, indicating 80% of the time it's inaccurate. And here's about the OAT test, organic acid test. They claim to detect an imbalance in the gut bacteria and fungi, but most of these microbial markers on these tests do not measure what they claim to measure. And this you put together with the urine testing, and you can see that the urine OAT test and the urine test for mycotoxin are not valid. So look for the body burden of chemicals in the body, not what's left the body in urine. And let's see what is the most accurate test. So the ELISA method to detect mycotoxins and human blood serum comes with significant accuracy, precision, and specificity. So this is from a published study, and that is that's MyMycoLab, what it does. 14 different mycotoxins. It gives you the toxic reaction, meaning how much is in your body, and it tells you if it's current exposure or past exposure, and if you have mast cell activation. What about the sensitive patient? Too many supplements. They come to see me with shopping bags full of 20, 30, 40, 50 supplements that they've taken. And they may have mast cell activation syndrome. But here's the key: the wrong diagnosis and the wrong treatment, the patient continues sick and gets more sensitive. The right diagnosis, the right treatment, patient gets well in about 6 months and is no longer sensitive. So what about supplements? All these people taking so many supplements. A recent study found that of 60 tested dietary supplements, 11% actually contain an accurate amount of the key ingredients, meaning that 89% do not. And 40% of these did not contain a detectable amount of the ingredients at all. There's the study at the bottom. It was published in July 2023. What about the rest? What about heavy metals? So in these supplements, they looked for the presence of lead, arsenic, mercury, cadmium, or pesticides, and found at least one of these in 93%. What about botanicals that are not vitamins or supplements, but botanicals, meaning from plants? Contained plant species not listed on the label. Additionally, active ingredient substitution was observed in 83% of the companies tested, meaning in 83% they changed and used, substituted what they say for something that is less effective and less costly. Talk about binders. This is people think binders do the trick, and about the liver and the bile and all this stuff, which is totally false medical science, and it does not exist. So what does this study show? On the binders that are inorganic materials, kaolinite, clays, activated carbon, zeolite, bentonite, etc. They're highly capable of neutralizing aflatoxin. However, they're ineffective in all other mycotoxins. And on top of that, they also bind vitamins as well as macro elements and micro elements such as zinc, magnesium, etc. And it doesn't matter what time of the day you take the binder. It binds all these things that your body truly needs. Here's another study showing that physical strategies such as the application of binders presented no sufficient effect against mycotoxins. So, important points about mycotoxins are these following. One is a mold that produces mycotoxins produces a series of mycotoxins, not just one. So one mold makes many mycotoxins, and if a mold known to produce mycotoxins is present in a home or building, then the mycotoxin itself is in that area and home or building or workplace or gym, etc., or a place that you go to on a regular basis. Now here's size. Here's 100 microns. Spores are 2 to 4 microns. Mycotoxins are 0.1 microns. Why? Mycotoxins are not living organisms. They're molecules. Toxins are molecules. Mercury is a molecule. Glyphosate is a molecule. Arsenic is a molecule. Okay, so when you test with MyMycoLab, you're testing for mycotoxins, and it tells you how much of each of 14 mycotoxins are currently causing a toxic reaction in your body. And the test will also say, is it current right now? Are you being exposed, or is this from something that happened in the past? So exposure to mycotoxins is mainly by inhalation or absorption through the skin. It's negligible by ingestion. What are the frequent misdiagnoses for the effects of toxic molds and mycotoxins? Fibromyalgia, chronic fatigue syndrome, chronic Lyme disease. We're going to touch on this in a minute. Depression, anxiety, that's resistant to treatment. Autism, PANS, autoimmune diseases, multiple sclerosis, rheumatoid arthritis, also lupus, all the autoimmune diseases. It also is misdiagnosed because it does cause dysautonomia and POTS, and of course, well-known breast implant illness. So I want you to look at this chart because this is what they looked at for finding mycotoxins. Look at the first column. There are 3 types: aflatoxin, ochratoxin A, and the last column is trichothecenes. Do you see aflatoxin? 0. Aflatoxins don't grow indoors. So well, we talked about this. So where do mycotoxins first affect the body? It shows that's the brain and nervous tissues where it's first affected. So what does that do? Autism and decrease in short and long-term memory in adults and children, optic neuritis, your vision, chronic inflammatory demyelinated polyneuropathy, also known as CIDP, published a book on that 20 years ago, Guillain-Barré syndrome, amyotrophic lateral sclerosis, better known in the public as Lou Gehrig's disease, Alzheimer's, multiple sclerosis, Parkinson's disease, and movement disorders. Here's a person on the left, October 2024. This is the wife of a dentist. She has dementia, as in Alzheimer's disease. She did the testing and the treatment, and look at her 6 months later, April 2025. And she asked that her eyes not be blacked out because she wanted everyone to see how miserable she was and how happy she is. Autism spectrum disorder. Study 172 children with 61 controls. Well, what did they find? Significant difference in comparing antibodies to mycotoxins. The autism group showing elevated antibodies to mycotoxins. This is the Tufts University School of Medicine in Boston. This implicates mycotoxins as causing autism. This was published in the Journal of Neuropsychiatric Symptoms. Here's two boys. On the left, they were 7. When they were 5, they were brought to me. And at 7, they were brought to me again just to show me how well they were doing. And on the right, this is when these twins are about to start university in engineering. So you can see I even wore the same type of color shirt. The only thing that changed is the color of my hair. Here's another young man. When he was sick, 6 years old, he had autism that was pretty severe. He is now 12. He came to show me. He had grown, obviously, that he had won the medal for being the top swimmer on his swim team at school. He was in a normal school. Let's talk about Lyme. Here's a study published from Johns Hopkins University School of Medicine. Mistaken identity. Many diagnoses are frequently misattributed to Lyme disease. Of 1,261 referred patients for Lyme, 1,061, or 84%, had no Lyme disease. So all these tests for Lyme are wrong. There's only one valid test for Lyme, and it's from Immunosciences Laboratories in Los Angeles. What about treatment? Let's take a look at treatment. First and foremost, the first rule of toxicology, otherwise nothing you can do will make it go away. Get the patient away from the toxin, or the toxin away from the patient. Now remember, that toxic mold may not be growing in your home. It may be at work. Maybe you go to a gym. It could be at the gym. I live in a hot climate here in Florida. In the summers, especially, when I go park my car somewhere because I'm going to supermarket or wherever, I crack my window a couple of inches so that when I get back into my car, it's not an oven. And sometimes I get back to my car and the seat is wet. Well, there was a brief thunder shower. I didn't check if there was mold growing on the carpet, but that could be a very real possibility, and it's happened to many of my patients. So due to this Lyme issue, I wanted to share this study that I published several years ago about Lyme looking very similar to mycotoxins, but instead the doctors test for Lyme because the main 2 tests, which are from Vibrant and IGeneX, are not acceptable tests for Lyme. So this is what I explain in this study. What is the treatment? It's not fluconazole. It has limited spectrum of activity. It is not active against Aspergillus and several species of non-albicans candida. Here is what it treats: yeasts. That's it. Does not treat Aspergillus, Stachybotrys, Penicillium, Cladosporium, or Fusarium. It does treat itraconazole, all these, the yeasts, as well as all the others. So, itraconazole, this is a study that was published on itraconazole oral solution and intravenous formulation, and they reviewed it. And here's what they found. Itraconazole is an antifungal agent with broad spectrum activity, meaning many different types of molds. It's well tolerated, highly efficacious. It produces consistent plasma levels of concentration and are ideal for the treatment of systemic fungal infections in a wide range of patients. Itraconazole treatment can be specifically tailored for use in all patients, including children. So, what about the safety? Yes, I know you read in Google or somebody said in Dr. Facebook that their eyeballs fill out, their tooth fill out, and all their hair fill out, and it's toxic to the liver and the heart and everything else. I've treated well over 18,000 patients, and I've yet to see any of that fall out. Anyway, those are anecdotes. Those are not medical science and medical evidence. They're stories or opinions, but not medical facts. And I told you at the beginning I was going to give you medical facts. So itraconazole, as this study showed, also known as Sporanox, is a common antifungal agent that was developed in the 1980s. It's been in clinical use for 35 years with an established safety record. Here's another study. Itraconazole is a broad-spectrum triazole. It has favorable pharmacodynamic and pharmacokinetic profiles. It's available both as oral and IV. It's been proven to be a valuable addition. Itraconazole has been well tolerated with doses up to 400 milligrams a day, generally being free of any adverse effects, any serious nothing. Okay? So remember, get the patient away from the toxin or the toxin away from the patient. Itraconazole, you have to take 8 specific supplements and vitamins at specific doses. These are available at detoxpure.com. And a low histamine anti-inflammatory nutritional diet. That is the treatment, and you do it for 6 months approximately. You won't feel any different the first 8 weeks, and then it kicks in. Look what patients are saying. I've watched most of Dr. Campbell's webinars on the MyMycoLab website 3 times each. I'm a health coach and was working for a group that had a shoemaker mold protocol, which was useless. I stopped health coaching at that program and focused on mold remediation in people's homes, as I think so many of my sick clients had mold in their homes without realizing it. Here's a doctor. I've never had the desire to study treatment for mold because the treatment and testing out there from Shoemaker, etc., have never convinced me. In my 9 years of practice, I've never really seen a patient go through that style of treatment and come out of the other side feeling better. I have been watching your videos on YouTube, and I'm excited to get rolling with treatment of a few patients with your paradigm. And lastly, I lectured at the A4M conference in Las Vegas in December of 2024. I'm usually a speaker there every year at that huge conference, over 7,000 attendees. And it says, Dr. Campbell, I'm simply blown away with your knowledge base. After hearing you at A4M, I dove into your videos, and I wish I had met you years ago after getting sucked into the Shoemaker Nathan vortex. at least going forward with your direction, I will be able to truly help my complicated patients. Thank you for that. So there's my email on top. And these are just 5 out of over 100 of my studies. If you'd like to have any of these, just email me and I'll be happy to email it to you. It won't cost you a dime. So folks, I hope I've taught you something and I wish you best. If you have any questions, email me. All the best to you.